Coronavirus cases are on the rise in at least 11 states. Dr. Fauci calling that data disturbing. Nationally, though, we are seeing improvement. The U.S. now averaging about half as many new cases per day as it was in July, but we're still talking about more than 34,000 new cases every day. Dr. Richard Besser joins me now. He's the former acting director of the CDC. He is the current CEO of the Robert Wood Johnson Foundation. Dr. Besser, it is always wonderful to have you on. 11 states reporting an increase in cases as we head into the fall. Is this what the start of a second wave looks like?
I wouldn't call it a second wave. I think what we're going to see across the country, Allison, is that as things change, as students go back to school, as college students come back into towns, as different parts of the economy get up and running, we're going to see increases in cases. And you have to look at each particular location on its own and say, okay, what's going on here? What's driving this increase in cases? As Carrie was just telling us in Florida, they're trying some new things. They're opening some bars. Well, it's going to be really important to track exactly what happens and see, does that lead to an increase in cases, or are they able to do it in a way that doesn't lead to that increase and spread within their communities? And we're seeing that around the country. As things are changing, we're going to see numbers go up. But the use of the term wave kind of gives a sense that something's happening everywhere at the same time, or it's rolling across the country. And I don't think that's how it's going to play out this fall.
How about vaccines? Let's talk about that. A big issue of concern for people. The CEO of Pfizer saying that they'll know by the end of October if their particular vaccine works. If it does, what does the vaccine timeline look like? What does that mean? And by that, when might the average person be able to get one?
Yeah, you know, one of the positive signs of sides of the vaccine development is that the federal government has paid for the manufacturing of a lot of vaccine even before the trials are done. So if trials are done and a vaccine is shown to be safe and effective, and the Food and Drug Administration is allowed to do their work and assess whether that's the case, and CDC can do their work, then it's possible that there is a vaccine. But the big if in what the Pfizer executive said is if it's safe and effective. And at this point, we don't have any of that evidence because the trials are still going on. So I think it's really important that we keep using the word if there's a vaccine, and that we really focus our efforts on what does it take to control this in communities without a vaccine, because the likelihood that a vaccine is going to play a big role this fall, this winter, I think is exceedingly low.
Dr. Besser, Politico today reporting that the Trump administration, some officials have the right to review and change CDC reports. Given your experience with the CDC, is this unusual, and how concerning is this to you?
It is highly unusual. I started my career at the CDC back in 1991, and over the course of my 13 years there, I was a co-author on many of those reports. And, they were sacrosanct. There was no political interference in terms of what went into those reports. There was a notice sent up to the Department of Health and Human Services so that they were aware of what was coming out. But there was a clear line drawn, and scientists were allowed to do their work. This document, this journal is called the MMWR, the Morbidity and Mortality Weekly Report. Not a very catchy title, but a title that resonates with the public health community. And there's a belief across the nation among public health providers that the information in the MMWR is the best public health science available. So anything that could cast a doubt on that is very, very worrisome.
What do you say to Americans who wonder, can and should they trust the data coming out of the CDC?
Well, time and time again during this pandemic, we've seen instances where there's been political interference, and that worries me greatly. We need to see a change where there's a hard line put in the sand that says nothing coming out of CDC will be subject to political interference. Without that, as we go into this fall, and we were just talking about vaccines, recommendations coming out of CDC around vaccine will be suspect, and that would be an absolute disaster. As a leading public health official was saying, vaccines don't save lives, it's vaccination. And we want to make sure that if there's a safe and effective vaccine, everyone wants to get it. And that's the entire community, making sure that communities of color are reached out to ahead of time so that there's trust there as well. If we don't do those things, we could have a vaccine that isn't able to have the impact we want because people aren't going to trust that it's safe and effective.
Trust, a huge issue here. Dr. Besser, thanks so much for talking through all of this with us. Always love having you on. I'll see you again soon.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.